Welcome to No Filter Doctor, where we cut through the health hype and dig into what's real, what works, and what's backed by evidence. I'm Dr. AK. Let's get into it. Hello, everybody. Welcome back. Today, we are going to talk about temperature-based therapies. And by that, I mean these cold plunges, sauna, hot water immersion. If you're on social media, I'm sure your feed at some point has had a very attractive, scantily clad individual stepping into one of these things. And then you hear things like autophagy and telomeres and inflammation and how great these are for all of those things. But I want to know, is there any truth in that? Am I missing out some amazing health benefit by not dumping my body into freezing cold water? Is there something about heat therapy that might be really beneficial that I don't know about? So these are actually questions that I have. They're genuine questions. Sometimes when I do these blogs and podcasts, I have a pretty good idea of what the data is before I go into it. Not so much with this. So I did a little bit of a deep dive in the research. And we're going to talk about the cold therapies first and then the heat-based therapies next. As we discuss these cold therapies, I must disclose my personal bias. I hate being cold. I mean, really, really hate being cold. When my husband and I first started dating, I told him there were 3 keys to my happiness. 1, I can't be hungry. The 2nd, I can't be sleepy. And the 3rd, I can't be cold. And this still holds true to today. If I am warm, I ate, and I slept well last night, I am in the most amazing mood. So really, the thought of putting my body into something cold sounds like a nightmare. In addition to all of that, I get Raynaud's phenomenon. And this may happen to some of you, but you didn't know what it was called. It's basically when you get cold and your fingers and toes change color and go numb. I'm literally the one that has battery packs for everything whenever we're out in the cold, even skiing. So the thought of being cold and then intentionally numbing my digits just sounds really unpleasant. But let's talk about it. Maybe there's some benefits here that I'm missing out on. Most of the cold therapies that you're talking about are these ice baths. And those ice baths are a form of cold water immersion therapy, which is defined as either putting all of or part of your body in cold water. The temperatures typically range anywhere from 10 to 15 degrees Celsius. And if you are in the United States, it's 50 to 59-ish degrees Fahrenheit. And these protocols can be durations of like 30 seconds all the way up to 20 minutes. The most studied regimen is 10 to 15 minute intervals in 50 to 59 degree temperatures. It can be done in baths. It can be an ice bath. It can be a cold plunge, in the river, can be cold showers. So there's a bunch of different ways of doing this. And this is not anything new. Cold water immersions have been around for centuries. It just happens to be re-emerging because people are saying all these great things about it in this health and wellness space, and they talk about these different perceived benefits. A lot of the benefits are based on actual physiology, though. Things do happen to our bodies when we are in an ice bath. One of the most well-known responses is something called a cold shock response. And that's characterized by people kind of gasping, they hyperventilate a little bit, their blood pressure will spike, and then they get this increased cardiac output. And this lasts about 30 seconds, and then it starts to calm down as the body acclimates to that temperature. And this is all in response to limiting heat loss. The body will release a norepinephrine and cortisol. This is part of what directs the blood away from that peripheral circulation. Remember I was talking about the fingers and toes going cold? It also induces shivering and it increases the heart rate. Heart rate variability also tends to go up with these cold exposures. And I actually find that very interesting because this may indicate that there are some competing influences from both sides of the autonomic nervous system. And if you need a little reminder on heart rate variability, you can go read the blog on it or go listen to the podcast because we talked about that before and we went into pretty good detail about HRV. Those are all the things that happen with your initial exposure. But then your body also adapts after you've done repeated exposures. That cold shock response is blunted, and then the body starts to use something called brown adipose tissue. So let's talk about what that is for a minute. Brown adipose tissue is a specialized type of fat that generates heat through an ATP independent process. So that means you don't need to shiver or do some of these other things in order to stay warm. It's very abundant in newborns, but it does also persist in adults. There was a study that looked at where there's brown adipose tissue with MRI technology and found that adults tend to carry this brown adipose tissue under their clavicles and in part of their upper chest. The thought is that activation of this particular type of adipose tissue can improve insulin sensitivity and then reduce white adipose tissue, which is traditionally the adipose tissue that we think of when we're thinking of fat. And while there is some brown adipose tissue activation with cold exposure, repeated exposures can increase the volume and capacity of those tissues, and then this might be associated with better metabolic flexibility. While I find all of these changes that occur with cold exposure very interesting, we also have to keep in mind that molecular changes do not necessarily translate into meaningful health outcomes. So what are the actual real-world benefits of these cold water immersions? Before we dive deep into this, it's important to know that most of the studies that are done on cold water immersion therapies are done on male elite athletes. So while there are some benefits of the ice bath, we really need to take a step back and question the generalizability of all of this data. Unless you are a male elite athlete, these study outcomes may not be applicable to you. Decreased inflammation appears to be a thing. It's an actual thing associated with cold water immersion. There's a study that was published in 2021 in the International Journal of Hyperthermia that looked at this exact thing. They had athletes participate in these short-term cold water immersions, and then they evaluated things like their cytokines, their inflammatory markers, their white blood cell count. This study demonstrated that reducing tissue temperatures will lead to decreased edema and decreased inflammatory markers. It can also significantly reduce post-exercise muscle soreness. And what they were looking at was temperatures, that same temperature range that we talked about, that 10 to 15 degrees Celsius, which translates to 50 to 59 degrees Fahrenheit. And they had the athletes in there for about 10 to 15 minutes. So decreased acute inflammation, decreased muscle soreness, these things will happen with cold water immersion. There was a 2012 study that came out that wanted to look at active recovery, and they did that by means of heart rate variability with the use of cold water immersion in elite athletes. And again, they found that these cold water immersions increased heart rate variability, which is a good indicator of strong active recovery. And that's kind of it in terms of the things that we know cold water immersion therapy does. There's a larger area that's kind of the gray zone. There are some claims, but we don't really know if they're true or not. One is this brown adipose tissue that we talked about. We don't know whether cold water immersion translates into meaningful improvements in insulin sensitivity or fat mass. A few studies using cold air or these water-perfused suits that people wore showed that cold-induced brown adipose tissue activation did increase whole body glucose uptake, and it improved insulin sensitivity in healthy individuals and people with type 2 diabetes. But the studies were very small. Even if you add the numbers of all the participants, it's less than 60 people. That is an extraordinarily small sample size, so it's really hard to determine whether this is something that would carry over into bigger study numbers. So the answer we get there is maybe. Maybe this whole brown adipose tissue activation and improvement of insulin sensitivity and glucose control is a thing. Another area of uncertainty is the immune effects, right? So we talked about the anti-inflammatory properties, which we know are true, but the immune system is also part of inflammation. And we know that cold exposure spikes norepinephrine, which is involved in immune signaling. but we don't really know if that translates to an improved immune function. There was a systematic review meta-analysis that was actually published in 2025, so this year, that looked at the effects of cold water immersion on health and well-being. That study found no difference between individuals undergoing cold water immersion and the control groups when it came to immunity, sickness, or illness. So the answer here is probably not. And I say probably not because at the time that we're talking about this, there are no randomized controlled trials on human subjects that investigate this. The last area of gray is that cold water immersion improves mental health, and the research here is very mixed. That same meta-analysis looked at this as well, and they were looking at levels of stress 12 hours post-immersion. And while there were some improvements in sleep quality, there were really no significant effects on mood or anything like that. Another study found, well, it might reduce your bad mood, but it won't do anything to improve your good mood or lead to a good mood. So maybe some benefits on sleep quality, but really not much else to say there. Let me tell you what ice baths do not do. These things have been studied, and the answer is no, but a lot of people in the wellness space make these claims. They do not lead to weight loss. While they do increase energy expenditure and they do activate that brown adipose tissue, no studies have demonstrated sustained reductions in weight or fat mass. Ice baths do not detoxify anything. I think this claim came from the fact that ice baths can decrease oxidative stress. That's part of those anti-inflammatory properties. And it can enhance lactate clearance after exercise. That's based on some of those elite athlete studies. This is not the equivalent of detoxification. There is no peer-reviewed scientific literature that a cold water immersion / ice bath removes toxins from humans. Your liver and your kidneys are what remove your toxins, and no studies have demonstrated enhanced liver and kidney function. And some people are going to argue, well, the liver is responsible for lactate clearance. Yes, it is. But when we are talking about lactate that is produced with strenuous exercise, there's other mechanisms at play. So my argument is there is more to this than just the liver. Last, but most certainly not least, cold water immersion has not been proven to regenerate mitochondria, reverse aging, fix your hormones, increase muscle production, make you live longer, or do any of these things that marketers and celebrities claim that it does. Improved molecular health span outcomes in animals that get immersed in cold water do not translate to improved clinical health span outcomes in humans. It is not the same. The other thing we have to keep in mind here is potential harm. I've said this plenty of times before. I said this about the alkaline water. There are really no proven benefits to alkaline water, but it does no harm. So if you want to drink alkaline water, bottoms up. We can't say the same thing for cold water immersion. There are harms associated with it, and that is very important to know. You remember that cold shock response that we talked about? There are several reported cases of cardiac arrest due to it. And if you don't believe me, I invite you to search polar plunges and cardiac arrest and see how many news stories come up related to it. Individuals with pre-existing cardiac conditions, things like coronary artery disease, arrhythmia, structural heart disease, even uncontrolled high blood pressure, all of those people are at high risk for cardiac arrest with cold water immersion therapy. There are also reports of people with perfectly fine hearts who also go into cardiac arrest with a cold water plunge. My theory is they probably have a prolonged QT or something like that wasn't diagnosed, and when they went in the water, the cold shock response sent them into an arrhythmia. If you're like me and you get Raynaud's phenomenon, you should also not go in these cold water plunges, nor should those with peripheral vascular disease or cold urticaria. You're not going to die. You just might be really uncomfortable. You might be in pain. You might be numb. You might be super itchy. There are certain things that can happen with that. The marketers and influencers don't like to talk about these things because if they tell you these things, you're not going to buy their portable cold water plunge system. but they are in fact things and you need to know about them. So what if you're someone like me who hates the cold, or you're someone with cardiac issues and you're like, hey, I want some of these benefits? There are other ways that you can achieve some of the health benefits without immersing yourself in cold water. Things like active recovery, massage, adequate protein intake, good sleep, they all have strong evidence in improving muscle soreness. Contrast therapy is another option, and it provides circulatory benefits. That's basically when you alternate warm water and cool water. Nothing extreme, but it's helpful. The bottom line is, if you're a competitive athlete and you are looking for improved muscle recovery, improved lactate clearance, decrease inflammation, those cold water immersions make sense. For everyone else, it really depends what your goals are. If your goals are longevity, you are not going to get that with a cold water plunge. There is no data to support that, so I wouldn't even put yourself through it. If you've done these before and you like that norepinephrine surge and you feel happy doing it, I'm not going to tell you not to stop, mainly because I'm not going to give you medical advice, but I would have a conversation with your healthcare team just to make sure you're not someone who's at high risk. And that is cold immersion therapy. Let us move on to heat therapy. Just like I shared my bias against cold water and how much I hate it, I will share my bias so that this, my friends, is my jam. I don't think anybody says that anymore, but I'm going to say it. It is. It is my jam. I love saunas and steam rooms and hot tubs. I love them all. But are there any health benefits to it? Because I think even though I love it, I need to know, is it benefiting me in any way? Is it causing any harm? So what does the evidence say about these? Heat therapy is defined as the repeated use of external heat applications to elevate your tissue or core body temperatures. The key here is elevating core body temperatures, and that's going to come back, which is why I stressed it. There are all kinds of different modalities for heat therapy. There's just hot baths you can draw. It's going in a sauna, doing heat wraps, hot water immersions such as hot tubs, steam baths. There are these things you can wear that heat up your body. So there's multiple different modalities to receive this heat. And just like with the cold water immersion, it could be part of your body or all of your body. Elevating that core body temperature is associated with a handful of different physiologic changes. We talked about cold water shunting blood away from the periphery. Well, heat therapies do the exact opposite. They promote the dilation of blood vessels and improve circulation. This can enhance delivery of oxygen and nutrients to places, and it can also help with the removal of metabolic waste products. On a cellular level, there's evidence of new blood vessel formation, mitochondrial biogenesis, and improved glucose metabolism through the use of intracellular calcium. Another molecular benefit is the upregulation of something called a heat shock protein. These are proteins that protect against cellular stress and inflammation. They increase nitric oxide production, they suppress inflammation, and they reduce oxidative stress. And the last thing is there is some evidence that heat reduces muscle stiffness and may dampen pain when we're talking about sensory nerve endings. There is evidence that all of these things together do actually enhance autophagy, reduce chronic inflammation, and improve mitochondrial function. But again, we are talking about molecular changes. So what are the actual medical conditions where you can apply heat therapy with some proven benefits? There is moderate quality evidence that shows heat wraps will improve pain relief and disability when we're talking about low back pain. There are various studies that compared heat therapy to doing nothing at all or using acetamin and ibuprofen, and what they found was that the pain relief was superior compared to that of the medications. But then when you combine them together and add heat, the pain benefit was even greater. A 2022 systematic review meta-analysis looked at heat therapy and what does it do in terms of improving functional and physical symptoms in people with acute and chronic musculoskeletal conditions. They found that these heat applications significantly reduce pain compared to no treatment, physical therapy, pharmacology therapy, and placebo. The study also found that it improves physical function, reduces disability, increases range of motion, and decreases stiffness. Obviously, if we're going to talk about improved circulation, you know there's going to be some studies that look at heat therapy and cardiovascular disease. There were 2 separate systematic review and meta-analyses that confirmed heat therapy has profound beneficial effects on blood pressure. There was also an improvement in blood flow. There may be some benefit in type 2 diabetes as well. There's a review article that came out in 2015 that discussed this. And what they were talking about is that heat therapy reduces the hemoglobin A1C by approximately 1%. And it also improves fasting glucose and insulin resistance in humans. Now, this was based on a small sample size as well. So I don't know that I would jump up and down and say 100% for sure this is a thing. This is a maybe. Just like we talked about maybes in cold therapy, this is a maybe. Another maybe is neurodegenerative disease. There is some observational data that came out of the Finnish sauna study. And when I say Finnish, I mean, country, not to end a race. So I just want to be clear about that. So we're talking about traditional sauna that's dry. There's the hot rocks. You pour water on top of them. That is one of the largest heat therapy studies that have been done. And they looked at that data and they found a cohort of patients where there may be some benefit in reducing the risk of dementia and Alzheimer's disease with the use of this form of sauna therapy. That study also gave us some pretty compelling data when it comes to longevity and mortality. The study identified a dose-dependent association between sauna use frequency and reduced all-cause mortality. Now that is impressive, but let's not go crazy. We need to talk about this a little bit. The main thing that we need to talk about is the application of this data. We talked about there are so many different sources of heat therapy, but the form of therapy that is linked to reduce mortality and decrease chronic disease risk is really from these traditional Finnish dry saunas. And why that matters is because you are going to get people who are trying to spin you on all the health benefits of these other heat therapies, but these benefits were not found with those heat therapies. So it's basically the misapplication of information. They used a very specific protocol in those sauna studies. It was exposures that were from 5 to 20 minutes. And the temperatures were 174 to 176 degrees Fahrenheit. It was also a very low humidity environment. The only steam that was there came in these brief bursts when they poured water on the hot rocks. And the study participants perspired a lot. You can't take all of that and say, oh yeah, well then, you should buy a steam room because you're going to get all these health benefits. That's a completely different beast. That's high humidity. You're not going to sweat the same way. Steam room temperatures do not reach 176 degrees Fahrenheit. But I promise if you look hard enough on the internet, you will find someone who's trying to sell you a steam room who will extrapolate the data from the sauna studies and say, hey, here, look at all these benefits. Can you please give me $8,000 now? Another therapy that I see a lot are these infrared saunas. Guess what? There is no evidence that supports the use of infrared saunas for the purpose of longevity. That being said, there might be some health benefits. Again, these were all small studies, but what they showed was that the infrared radiation can enhance endothelial function and reduce arterial stiffness. They might enhance insulin sensitivity, maybe reduce inflammation, and they might improve chronic pain. So there are these studies that show this information. If your goal is longevity, infrared is not the way to go. If your goal is one of these other things, then infrared may be the way to go. It's important that we also cover hot water immersion in terms of a mode of therapy and what health benefits it can provide. The thing that's really important here is elevation of core body temperature. The belief is that the elevation of core body temperature may be what is responsible for a lot of the different longevity benefits. There was a study that directly compared hot water immersion with Finnish sauna and infrared sauna in terms of core body temperature. They found that if you sit in a hot tub that is set at 104.9 degrees Fahrenheit for 45 minutes, It will elevate the core body temperature by about 2 degrees Fahrenheit. The traditional sauna that was used in that study elevated body temperature by about 0.72 degrees Fahrenheit, and the infrared sauna didn't elevate it at all. There are also some other studies that have looked at hot water immersion from an inflammatory standpoint, cardiovascular benefit standpoint, and also longevity and anti-aging. And the jury is still out on this one. We think there might be something there, but we don't have the same kind of data that we have from those traditional sauna studies. And if you're like me and a lover of steam rooms, I'm sorry, I'm sending you a hug because there just really is no data at all. There's no clinical research. There are some molecular things that are out there, but there's no clinical research to show that there's any improvement in any health outcome in terms of longevity, anti-aging, or mortality. So if we're going to pick a winner between hot and cold in terms of longevity, hot is going to win because of these traditional sauna studies that we have. There may be a little bit of data coming out about hot water immersion. Stay tuned for that. But the infrared and the steam room don't get any love in terms of heat therapy and longevity. So now when you are on your social media and you see these very attractive, scantily clad individuals who are going into any number of these temperature-based therapies, you can sit back and call nonsense on some of them and then say, that actually might be true for some of the other ones. I also invite you to have a conversation with your healthcare team to see whether your health goals align with either of these temperature therapies and see whether you might be a good candidate for any of them or whether you might actually be high risk and you should just steer clear altogether. I will sit back and find solace in the fact that if you did in fact listen to this podcast, you will not be a sucker for the marketing that happens with either one of them. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, The Whole Human Health and Wellbeing. Take care, and I'll talk to you next week.